One small group of my clientele are those clients who are afraid of sex. Being afraid of sex, having increased anxiety at the thought of having sex, is something we call genophobia. Genophobia is not in and of itself in the DSM-5 revised, and the reason is because it's classified with all kinds of phobias. It is a phobia, and like other phobias, anxiety and what happened to a person can have a real effect on how it comes across. But when it comes across as a fear of sex, and you're with someone in a relationship and they don't understand it, then it can be a big problem, as you can imagine. For men and women, both men and women have this. For men, it may be sexual impotency, or they may, not be able to have sex. They may get so anxious they don't want to have sex, so they have a long history of it. Women may fear it for other reasons, but the result is usually that they don't enjoy sex and it looks like their libido's really low, when in fact it's a fear of having sex or the intimacy of sexuality. So what are the signs and symptoms of this? Well, several. I've got several, so I'll go through some of them. An immediate intense fear of anxiety anytime sexual intimacy is thought of or engaged in, and this can be alone or with their partner. An inability to control the fear of anxiety, even if you acknowledge that it's unwarranted. An avoidance of behavior, irritability, sleep disturbances or challenges, restlessness, nausea, fatigue, dizziness, muscle tension. And once again, these symptoms are all at times that the person is thinking about sex or wanting sex, or maybe being pressured in a relationship for sex. Now, how does this come across? Like, how would you see genophobia if you were with someone who actually had it? Well, it may be screaming or yelling at your partner during intimate moments. In other words, they do this as a way to push their partner away, sabotaging relationships to avoid sex. I see a lot of that in my clinical practice, and that's why the couple comes in. Not dating or being open to romantic relationships, making excuses not to have sex, consciously or unconsciously making yourself physically undesirable. Once again, you see this. I work with a lot of morbidly obese people, and underneath they have a true fear of sex, and it usually comes from a past experience of being sexually assaulted as a child, and we'll get more into what causes it. Acting unapproachable in social situations, and freezing or being unable to move in a situation of sexual intercourse. The causes, many times, as I've alluded to, when people make themselves less desirable so they won't be asked to have sex, it's sexual abuse. It could be sexual assault. Witnessing a traumatic experience can do it as well. Pain during your sexual encounters, especially those first sexual encounters. If there's intense pain and maybe a partner who is not as loving, as supportive, then you could develop a true fear of intimacy. Possible causes of it: conditions that make sex painful, like vaginismus or endometriosis. Vaginismus is something I see a lot of when couples have had an arranged marriage and they don't really know each other, and they've never been exposed to sexuality or talked about sexuality with anyone, their parents or anyone. It was always taboo. Then many times these women will have vaginismus, and it makes sex almost impossible. Having insecurities about your body image. If you were raised in a very insensitive family, and they talked about your body or called you names, thunder thighs, or fatty, or anything like that, then you may have some of these fear of sexuality aspects or phobias develop. living with another type of anxiety disorder. So sometimes if you have another phobia that you currently are trying to mitigate or make better, then it will generalize into the sexual one, especially if you've had some sort of trauma in your background, being exposed to explicit sexual acts or media as a child. So if you saw something as a child that scared you sexually, or you were exposed to something that scared you and was traumatic, absolutely you could end up with a genophobia. Experiencing cultural practices such as female circumcision. Many women that come from other countries struggle with this because they had been what I consider mutilated, or had something terrible happen that was done to their body as a form of a cultural ritual, and then they turn out being very scared of having sexual intercourse with good reason. And once again, if that's your situation, then you would really want to watch one of my videos about being sexually traumatized and trying to have a relationship after. Believing sex is directly related to negative spiritual consequences. You'll see this in homes where there was a very fundamental faith and they made the children feel nasty or like they were sinning if they had sex. And these children, when they grow up, they severely have a phobia about sexual intimacy, about having a partner and what that means. And lastly, being sexually assaulted. How do you cure this, or what is the best treatment? The best treatment is going to be to go to a therapist. If you are in a relationship, it's extremely important what your partner does, how they respond. Are they supportive? And if I were advising you here, I would say look for a therapist that you can talk to very calmly. Then go with your partner if that's possible. If your partner is supportive of you, make sure they come with you to that appointment. From there, that sex therapist may want to help you find an OBGYN or a urologist if you're a gentleman, and they're going to try and make sure that medically there is no other reason, because some medical illnesses can be the culprit of where this started or what's going on with it now. And so it's very important that you get assessed, but I would start with therapy. Cognitive behavioral therapy usually is best, but there are many other forms as well that we can help you with. In the case of vaginismus, if a therapist can help you understand the fear, then many times something as simple as getting Botox injections can help you relax so you're successful enough to have sex. And then after that, the confidence from that, as well as the therapy, changing your thoughts, learning ways to manage your anxiety, are really going to be helpful. This is an interesting topic, and I really will appreciate your comments where you need more help with this situation in particular.